Hey everyone, good morning. Today, first of all, happy Friday. uh, Today I'm talking about PCOS and pregnancy. So, skip over this if you don't want to really learn about pregnancy just yet, if you're in the stage of fertility, because I know it can be triggering. But I do want to kind of come on here and talk about PCOS and my pregnancy journey. For those of you who want to learn a little bit more about pregnancy, and also if you have any questions about fertility as well, please let me know, drop it in the comments below. But I'm just going to share a little bit about my journey the last 8 months on being pregnant. It's been actually very uneventful or eventful at the same time because everything is so new. But really, I haven't had any symptoms that have been really bad. In the very beginning, obviously, lots of fatigue, and a lot of women complain about this, but it's actually a good sign that progesterone is rising nicely. I was also taking progesterone on top of my natural progesterone production in pregnancy, so that could have also contributed to the fatigue. But extremely tired, going to sleep at like 8 p.m., waking up at 9 a.m., so like long sleep that I usually wouldn't be doing. Usually go to sleep at 10, wake up at 7. So at the very beginning, fatigue was a really big one for me. I had a little bit of nausea, but it wasn't very severe. I actually, I was making sure I was getting enough protein during the day, and this is really important when it comes to nausea, is making sure you get enough protein because that really helps to curb the nausea. So it's really important, especially if anybody out there is experiencing nausea in pregnancy, to make sure that you take protein. Oftentimes collagen protein powder is nice because it doesn't have very much of a taste, and you can stick it into coffee, tea, whatever you're drinking, even just water, or even into a smoothie, for example. So protein is probably the number one thing for nausea. And then herbal teas like ginger and peppermint can also be great here. So that was first trimester for me, just a little bit of nausea, lots and lots of fatigue. And then the second trimester came around and just starting to feel a little bit more uncomfortable, but mostly trying to figure out like what foods were still okay for me. A lot of foods actually were perfectly fine. There was only a few times where I felt like I didn't want to eat certain foods, but I can tell you for sure in the first and second trimester, mostly in the first, I had really big sugar cravings to the point where I started eating candy again. Like my very favorite is like Maynard's berries. So started eating those types of candies, and then I started eating Smart Sweets because they didn't have a lot of sugar in them. And then once, at this point, I think I had accidentally stopped my inositol. And so I introduced that back in, and that really helped to curb the sugar craving. So then right after that, it was done. And this was kind of around Halloween as well, so lots of candy everywhere. So that also didn't help the cravings. So I think that's what kind of drove that up for me. But I gave in. I had some sugar, which is perfectly fine. Obviously, there is going to be cravings, and it's okay. And then at that point, putting the myoinositol back in really helped me. So second trimester now, I'm waiting for the ultrasound, the anatomy ultrasound. And one big thing for me is one time I've been to the chiropractor a long time ago, they did an x-ray, and the x-ray actually showed that I had a little bit of Spina Bifida, which basically means there's a tiny little hole in the middle of the spinous process in the spine, and that can cause neurological issues. But there's times where this hole can be just very tiny and not cause any actual issues in the patient. So for me, I never knew that that was a thing until I got an ultrasound, and a lot of people don't know until they get an ultrasound report. So anyway, so I was a little bit afraid that maybe I would pass that down because it is genetic. But I was trying to make sure I was getting enough folic acid. Oftentimes they'll recommend higher doses of folic acid, about 5 milligrams of folic acid, but even if you take the activated form of folic acid, which is folate, that can be enough in terms of 1,000 micrograms. So just make sure you talk to your doctor if you have any history of any neurological issues, and if you should be taking a higher dose of folic acid before pregnancy and then also during. Anyways, I had a genetic report done before pregnancy, and this genetic report said that I actually can convert folic acid to folate, so I wasn't too worried that I wasn't getting enough folic acid because I knew I could convert. Anyways, I went through the ultrasound. Everything looked okay on ultrasound in terms of the spine, so I was really happy about that, but very anxious, very nervous about the ultrasound, because that's the one where they will actually look at the full anatomy from head to toe. So kind of once you go through that one, then they can say, okay, everything looks good to go, and that's when they also look for the gender. So I don't know if you guys have seen on Instagram this morning, if you follow me, but I'm having a girl, which is very exciting. I didn't really even think about gender until kind of when we started trying, and then when we went to that anatomy ultrasound. So, but I'm really excited either way. I have 2 nephews in my family, and so this is the first girl, and on my husband's side it's the first grandchild, so it's really exciting that a girl is going to be entering in our lives. So anatomy ultrasound went great. The ultrasound tech was really, really helpful. She even showed me the spine to make sure that I could see too that there wasn't any spina bifida. And then after that came the oral glucose tolerance test. So I'm not sure if you guys know a little bit about this test. Sometimes we actually do this test to test in PCOS for diabetes, right? But I also do the test in pregnancy. The difference is in pregnancy, they actually only give you 50 grams of glucose, versus if they're really challenging the body to find diabetes outside of pregnancy, they'll actually give you 75 grams of glucose. So in pregnancy, I did the oral glucose tolerance test. And before the test, about a month before, I was really trying not to eat too much sugar. I really have enjoyed fruits this whole time. So, and I actually don't have stopped eating a lot of fruits before pregnancy because, they are high in sugar for me and I do get sugar crashes from them. But in pregnancy, I've been eating basically every single fruit that's in season, oranges, apples, bananas, kiwis, still lots and lots of berries, but then also eating a mango here or there. Because when I was pregnant, mangoes weren't really in season. We were kind of entering into fall, so I love mangoes. I grew up with mangoes, and I think it's mostly because my mom ate a lot of mangoes when I was in utero. But all in all, I brought down the sugar consumption before the oral glucose tolerance test just to make sure. I really made sure I was taking inositol during pregnancy during this time and not forgetting the inositol because it can really be helpful for prevention of gestational diabetes. So I started taking that. And usually they test oral glucose tolerance around week 24 to 28. So I think I went right before Christmas because I wanted to eat some sugar during Christmas time because there's lots of good pastries and chocolate around that time too. So yeah, I ended up passing that test too, which I was really excited about. And then now this is the end of the second trimester and we're going into third. So about the third trimester started for me beginning of January. And throughout this whole time, I'm taking a little bit of echinacea just in case, especially in the second trimester, and then upping my vitamin C so that I don't get sick. And I try to stay away from a lot of places, really only going to the grocery store every week. Working from home was really, really helpful, and just limiting my exposure as much as I could. So then In the third trimester, so this started in January. It's actually been going really well for me. Really only this week and the last few weeks is when I've started to notice some swelling and some pain, especially in my back and in my feet. Honestly, the feet are the worst. But I've been to an osteopath actually a few weeks ago, and they were really helpful at, massaging the fascia on my feet, which ended up like really helping with the pain. So I haven't had very much feet pain after that. It's kind of coming back, but I'm going to osteopath again on Monday, so hopefully that will help. And then I've also seen a pelvic floor physiotherapist, which has been extremely helpful at guiding me on pelvic floor breathing exercises, and also helping with, now we're talking more about labor and delivery and how we should be pushing in labor. And they actually do an internal exam, so they'll actually go and check inside to feel the muscles in the pelvic floor to see if you're actually doing the exercises correctly and you're actually opening up that pelvic floor and relaxing the pelvic floor. These are the muscles that kind of line the very bottom of the pelvic bone. And so if you are pregnant, I would really suggest going to see a pelvic floor physiotherapist, and especially in the second trimester is when they usually start to see the patients, and then more so in the third trimester and postpartum. They can also help to prevent things like urinary incontinence and diastasis rectus, which basically means like the muscles in between the abdominal cavity kind of separate, and they can help with that as well. Throughout this whole time, actually, the first trimester, they told me to really reduce exercise and not do too much, just in case. So really, I just went for walks, and I was really tired too anyways after the first few weeks. So then I ended up just not even walking and just resting, listening to my body as much as I could. And then in the first and second trimester, just continuing yoga. Honestly, that's the most exercise I've done this whole time, because even just, I did some weights, I did some stairs, but then it came time to move. So I actually was moving during this time as well. So packing and putting everything away, that was like really, really helpful, because it actually got my body moving and I felt like I was exercising. And I still feel like I'm exercising because we're still trying to, unpack everything, and lots of moving around and walking and things like that. But still sticking to prenatal yoga and trying to do it at least weekly and just stretching my body, which has been really nice. So next test that I actually just did was the Group B Streptococcus test. And so this is GBS. And sometimes with GBS, we can actually have this bacteria that lives in the vaginal canal. And if there is bacteria there, then that can actually be transferred to the baby. So it's really important to get tested for GBS because it can cause issues with the baby once the baby's born. The way that they prevent GBS, if the person's positive before labor, is they will give antibiotics, unfortunately, but fortunately, because it does help with prevention of disease. So just waiting for that test, and fingers crossed that I am negative, because I really don't want to take antibiotics. But if I do, I'll be okay with it, because that's just what needs to happen. And then, and right now, really the biggest thing is just a lot of movement. Baby's moving a lot, which is really nice. Actually, I started feeling the movement week 19 of pregnancy, which was really nice to know that somebody's in there and she's moving and she's doing well. So I hope this was helpful for you to like really kind of see like what my pregnancy has been like. Really kind of uneventful, mostly me making it more eventful by being stressed about everything. But day after day, feeling more and more confident that everything is going to be okay. And now just preparing for labor. And some of the things that I've been doing for that are seeing the pelvic floor physio. I'm doing perineal massage now going to start some acupuncture week 37 of pregnancy, so next week. And I'm going to be needling myself because I feel the most confident doing that. And then, what else am I doing? Those are like, oh, and I'm doing a hypnobirthing course. So a long time ago, I was a doula and found that hypnobirthing was probably one of the best ways that I've seen labor progress really nicely in a calm and relaxing environment. So we've been doing a hypnobirthing course. This is basically to teach you breathing exercises to help calm the nervous system down, to help deal with the waves in pregnancy or the contractions. So that's what I've been doing, then practicing the breathing exercises and trying to open up the pelvic floor with the breathing as well. So I hope this was helpful. If you guys have any questions at all, please drop them in the comments below. Let me know if there's anything that you're interested in knowing or learning about, and I'll make sure I can get back to you. Take care, guys. Happy Friday.